Your legs feel heavier than they used to. You notice it on the stairs. You notice it getting up from the couch. You notice it in the morning when your body takes longer to feel like your own. You've been calling it aging. You've been accepting it as something that simply happens. But what if it isn't aging? What if your body is losing muscle at an accelerating rate right now because of something you are not drinking? Not a supplement, not a prescription, something so ordinary, so inexpensive that most doctors never think to mention it as a solution to one of the most disabling things that happens to the human body after 60. That changes today. My name is Dr. Elena Marsh. I've spent more than 2 decades in clinical practice watching the same pattern repeat itself. Patients in their 60s and 70s growing weaker, slower, less stable on their feet, and being told it was simply part of getting older. Accept it, adapt, get a cane. I stopped accepting that answer a long time ago because the research tells a different story. A study published in the American Journal of Clinical Nutrition tracked more than 2,900 adults over 3 years and found that the single most powerful dietary predictor of muscle mass preservation after 60 was not protein intake, not resistance exercise alone. It was something most people either consume incorrectly at the wrong time or not nearly enough of. And its connection to muscle loss is one of the most underexplained findings in geriatric medicine. I want to give you that explanation today, clearly, completely, because you deserve to understand what is happening inside your body and what you can do about it starting this week. Quick question before we go further. How much water do you drink on a typical day? Not juice, not coffee, not tea, plain water. Type your honest answer in the comments right now. I read every single one, and your answer is going to matter more than you think by the time we reach the protocol. Let's talk about what muscle loss actually is, because most people have a vague sense that it happens, but very few understand the mechanism, and the mechanism is everything. The medical term is sarcopenia. It comes from the Greek, sarx, meaning flesh, and penia, meaning loss. It is not a disease in the traditional sense. It is a biological process, a gradual, measurable decline in both muscle mass and muscle function that begins as early as your mid-30s and accelerates significantly after 60. By the time most people are 70, they have lost between 20 and 30% of the muscle mass they had at 40. By 80, some research puts that number closer to 40%. And the consequences are not cosmetic. We are talking about fall risk, fracture risk, loss of metabolic regulation, insulin resistance, increased cardiovascular strain, the inability to perform the basic physical acts of an independent life. But here is what most people, and many physicians, do not fully appreciate. Sarcopenia is not driven by age alone. It is driven in significant part by a cascade of cellular events that a specific, widely available, zero-cost substance has been shown to interrupt. A substance your body is almost certainly not getting enough of. A substance so fundamental to muscle protein synthesis that without adequate levels of it, no amount of dietary protein, no amount of exercise can fully compensate. I am talking about water, but not water in the way you've been thinking about it. What's happening inside your muscle tissue right now, at the cellular level, is more urgent, more specific, and more correctable than anyone has likely told you. And that is exactly where we are going next. Your muscle tissue is approximately 75% water. Not roughly, not approximately in a vague sense, 75%. That number is not metaphorical. It is structural. Water is not a background player in how your muscles function. It is the environment in which every critical process inside your muscle cells takes place. When you are even mildly dehydrated, and mild means losing just 1 to 2% of your body's total water, something specific happens inside your muscle fibers. The concentration of electrolytes shifts, the movement of nutrients across the cell membrane slows, and most critically, the process of muscle protein synthesis, the biological mechanism by which your body builds and repairs muscle tissue, becomes measurably less efficient. This is not a theory. A study published in the Journal of Strength and Conditioning Research measured muscle protein synthesis rates in adults over 60 under 2 conditions: adequately hydrated and mildly dehydrated. The difference was not marginal. Muscle protein synthesis dropped by more than 20% in the dehydrated state. 20%. From a 2% reduction in body water. That is happening inside your body on any ordinary afternoon when you have been too busy or too distracted or simply unaware of how little you have been drinking. Now, here is where this becomes more serious than most people realize. After 60, your body's thirst mechanism weakens. This is not a minor inconvenience. It is a clinical reality with a name: age-related thirst impairment. Your kidneys become less efficient at concentrating urine, which means your body loses water faster. Your sensation of thirst arrives later, sometimes long after your cells are already operating in a dehydrated state. You can be significantly dehydrated and feel nothing, no dry mouth, no headache, nothing, which means that for millions of adults over 60, chronic mild dehydration is not an occasional problem. It is a permanent background condition, and it is quietly accelerating muscle loss every single day. But the connection goes deeper than protein synthesis. Here's what that means for your body specifically. Your muscles do not exist in isolation. They communicate with your nervous system through a network of electrical signals that depend entirely on the movement of electrolytes, sodium, potassium, magnesium, across cell membranes. That movement requires water. When hydration is insufficient, signal transmission slows. Muscle activation becomes less precise. Coordination degrades, and what you feel as weakness, as heaviness, as instability, that is often not your muscles failing. That is your muscles not receiving the signal clearly enough to respond. There is also the cortisol connection. Dehydration, even mild dehydration, triggers a measurable rise in cortisol, your body's primary stress hormone. Cortisol, when chronically elevated, is directly catabolic to muscle tissue. It accelerates the breakdown of muscle protein. It counteracts the anabolic signals that tell your body to preserve and rebuild. In other words, a body that is chronically mildly dehydrated is a body that is biochemically biased toward destroying muscle rather than protecting it. Not because of age, because of water. This is the part your last appointment skipped. Not because your doctor doesn't care, because explaining the full mechanism of dehydration-driven sarcopenia takes more than the 7 minutes most appointments allow. You have that time now. Has your doctor ever explained this connection to you? Write never or yes in the comments right now. I want to know how many people watching this were never told that something this simple could be driving something this serious. Now here's the secondary risk, the one that makes this more urgent, not less. Muscle weakness from chronic dehydration does not stay contained to your legs or your grip strength. Weakened skeletal muscle is the single strongest predictor of fall risk in adults over 65. Falls are the leading cause of fatal injury in that age group. And the majority of falls are not caused by slippery floors or bad luck. They are caused by muscles that were not strong enough or responsive enough to correct a moment of imbalance. The research is direct on this point. A 2019 analysis published in Age and Aging, one of the leading journals in geriatric medicine, found that adults with measurable sarcopenia had a fall risk more than twice that of age-matched adults with preserved muscle mass. Twice the risk, from something that begins at the cellular level, from something that responds to what you drink. Stay with me, because what I'm about to give you addresses all of this. The protocol is next. It starts with something most people do completely wrong, and it costs nothing. Here is exactly what I want you to do, starting today. What I'm about to give you is called the Muscle Hydration Protocol. 5 steps, no equipment, no cost, no supplements. Each step is built directly on the biological mechanisms we just covered, and each one addresses a specific point in the chain where dehydration-driven muscle loss either accelerates or can be stopped. You are going to understand not just what to do, but exactly why your body responds the way it does when you do it. Step 1. Drink 16 ounces of plain water within 10 minutes of waking up, before coffee, before food, before your phone. Here is why this matters more than any other glass of water you will drink all day. During sleep, your body loses water continuously, through respiration, through perspiration, through the ongoing work of cellular repair that happens while you rest. By the time you open your eyes in the morning, you are already in a mild dehydration state. And in that state, cortisol, which naturally peaks in the first 30 to 45 minutes after waking as part of your body's normal arousal cycle, has no hydration buffer to counteract its catabolic effect on muscle tissue. Drinking 16 ounces of water immediately upon waking interrupts that cortisol spike before it can do meaningful damage to your muscle protein. It rehydrates your cells before they spend the first hour of your day in a breakdown state. 16 ounces, 10 minutes, every morning. This is the single highest leverage action in this entire protocol. Step 2. Add a small pinch of salt and a squeeze of half a lemon to your morning water. not a sports drink, not an electrolyte powder. A pinch of plain table salt and fresh lemon juice. Here is the mechanism. Water alone, consumed rapidly, can actually dilute the sodium concentration in your blood, a condition called hyponatremia in its severe form, but even in mild form, it reduces the osmotic pressure that drives water into your cells. Your muscle cells are not hydrated by the water sitting in your bloodstream. They are hydrated by water that crosses the cell membrane, and that crossing is driven by electrolyte balance. A small amount of sodium paired with the potassium naturally present in lemon juice restores the electrolyte gradient that allows water to actually enter muscle tissue rather than simply pass through your system. This is cellular hydration. It is different from drinking water, and it is what your muscles are actually waiting for each morning. Step 3. Drink water on a schedule, not when you feel thirsty. Set a timer on your phone or watch for every 90 minutes throughout the day. When it goes off, drink 6 to 8 ounces of water. Not more. Not a large volume at once. The reason is physiological. Your kidneys can only process approximately 27 to 33 ounces of water per hour before they begin excreting the excess. Drinking large amounts infrequently floods your system and produces a false sense of hydration while your cells remain starved. Distributing intake across the day, small amounts, consistent intervals, maintains the intracellular water balance your muscle tissue needs for continuous protein synthesis. And because your thirst mechanism after 60 is no longer a reliable signal, the schedule replaces the signal. You are not drinking because you feel thirsty. You are drinking because your muscle cells require it, whether you feel it or not. Step 4. Drink 8 ounces of water 30 minutes before every meal. This step addresses 2 mechanisms simultaneously. First, pre-meal hydration primes your digestive system to process the dietary protein you're about to consume, the amino acids your muscle tissue needs to rebuild. Without adequate hydration, gastric acid concentration is reduced, enzymatic activity slows, and protein absorption becomes less efficient. You can eat exactly the right amount of protein and have your muscle cells receive significantly less of it simply because your digestive system was not adequately hydrated to process it. Second, research published in the journal Obesity found that adults who drank 16 ounces of water before meals experienced measurably better metabolic function and body composition outcomes than those who did not. 8 ounces before each meal, 30 minutes before, every time. Step 5. End the day with 8 ounces of water 30 minutes before bed, paired with a small amount of magnesium-rich food. A small handful of pumpkin seeds, a few almonds, half a banana. Any of these will do. Here is why. Magnesium is the electrolyte most directly involved in overnight muscle repair. During sleep, your body enters its primary anabolic window, the period of deepest cellular recovery. Magnesium regulates the enzyme systems responsible for protein synthesis during that window. Without adequate magnesium, the repair cycle is incomplete, and magnesium requires water to be absorbed and transported to muscle tissue. The water and the magnesium-rich food together create the conditions your muscles need to spend the night rebuilding rather than simply resting. 8 ounces, 30 minutes before bed, a small handful of seeds or almonds alongside it. That is the final step. 5 steps. The muscle hydration protocol. Starting tonight, you came into this video believing that what you were feeling in your legs, in your grip, in your mornings was simply the price of getting older. You are leaving with something different. You are leaving with the science that explains exactly why it is happening, and a protocol you can start tonight that costs nothing, requires nothing you do not already have, and addresses the biological mechanism directly. Your body has not been failing you. It has been waiting for water, the right amount, at the right times, with the right support. That is all the muscle hydration protocol is, and that is enough to make a measurable difference, not in months, but in days. There is someone in your life, a spouse, a sibling, a friend, who gets up every morning already losing this battle without knowing it, who calls the heaviness in their legs aging, who has never once been told that 2% dehydration is cutting their muscle protein synthesis by 20%. This video can reach them before that information becomes too late to use. Send it to them today, not for this channel, for them. If you have not subscribed yet, please do that now. Every week I bring research-based, clinically grounded information about what your body needs after 60. The information I spent 2 decades wishing every patient had before they ended up in front of me. Subscribe so you do not miss what is coming next. Everything I have shared today is based on published research and clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medications, diet, or daily routine, please speak with your own doctor first. They know your history. Bring this information into that conversation. That is exactly where good medicine begins.